back now, and Dr. Darien is back with us answering a question from one of you. This one is from Diana K. How do I know if a burn is severe and when should I see a doctor?
I love this question because, number one, we have the FDA Fire Commissioner coming on later today, so what a better time to talk about something so contextual, burns. It's something I see often in the emergency room. I think the first part is stepping out or stopping to understand what type of burn you have. So you have different degrees. We really qualify them in terms of how deep they are and how big they are. So the most common, first-degree burns. Those are the most common that can happen from just simply getting burnt by a candle, for example. It often includes redness over the skin. It is superficial and only affects the top layer of skin. That's something that's often going to heal on its own. And then you can move on to second-degree burns. Now that involves the top layer and that second layer of skin, and these burns often blister. One important note, many of us want to pop those blisters and do things with those blisters. Leave the blisters alone. They're helpful for your body in terms of healing. And then we can step to the third-degree burn. Those are the deep burns. These often require the care of an emergency response team, emergency physician. This burn goes so deep sometimes that it can be painless because it can burn the nerve. And so it can be deceiving in the fact that it doesn't have pain, but you can usually tell how deep they are, and we're talking about incredibly deep, past fat, past muscle, sometimes down to bone.
So you don't have to see a doctor if you have a first-degree burn?
You often don't, but DeMarco, great point. If it is large enough or in sensitive areas, like on your face, on your hands, then you might want to check in with a clinical provider. So it's about the size, how deep it is, and where it is.
So what is the treatment for a burn? Because we were just talking, DeMarco here was talking about
butter.
butter.
My mom used to say put butter on it.
And I'm so happy you brought that up. Let's avoid that. Like I said, let's end that today.
Morgan, don't do that.
So there's some basic things we can all do for burns, things that you have around your house. Number one, making sure that you run that burn under cool water. You can keep it underwater for up to 30 minutes. That's not only going to help you with pain, but it's also just going to help with the treating or the healing process of the burn. And then as far as products, avoid oil, avoid butter. You can put things like aloe vera onto sunburns, which can result in first-degree burns, and you can also use things like Neosporin or bacitracin. But honestly, I just keep it simple. Just basic petroleum jelly is probably beneficial and helpful. And then you want to cover that burn with a gauze or clean dressing. You want to keep it safe because the next thing you want to prevent is infection.
And Mama's not crazy. You've heard of people actually putting butter on burns,
I have
right?
heard. I've seen people. Patients have come into the emergency room with all types of products on their burns. The more complicated it gets, the more complications you can see, so keep it simple.
All right, Doc, thank you very much. We appreciate it. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for Dr. Darien at ABC GMA3.
And just to be clear, we love Mama Morgan.
Oh, thank you. She loves you too.
I just want
And I respect her choices.